Hey, it's Jessica DaMassa with WTF Health. Joining me right now, I have Mark Switaj. He is the founder and CEO of RoundTrip. And so you guys are a company that helps coordinate transportation for patients, right?
That's exactly right.
Okay, why wouldn't they just use Uber?
Because a lot of folks, for cognitive reasons or just physical impairment, are unable to get into a rideshare vehicle.
Okay.
And so we fixed that.
All right, cool. So talk to me a little bit more. I didn't mean to be so cheeky right off the cuff here, but truly, it's one of those situations where you guys are doing something a little bit different. So tell me a little bit about your model and how you guys work.
Yeah, so we actually approached this space. I come from the industry, but we looked at creating actually a marketplace, right? So there are a lot of transportation companies out there that are providing these more advanced rides. So
what do you mean by advanced ride?
Yeah, so think somebody, like we were talking about before, somebody that can't easily get into a ride share, maybe somebody that's in a wheelchair or needs that more TLC.
Yeah.
We aggregate all the transportation options together into a marketplace that can provide those options.
Okay. And so your customer base is primarily hospital systems, doctor's offices, or is it direct to consumer?
The former. So our primary customer base is, like you said, a hospital, a health system, and actually managed Medicare plans. And we'll get into a little bit what's going on there.
Well, why don't you go ahead and just do that? Because I'm like, no, because this is like a brand new thing, right? And so, there was a couple, I think it was maybe the beginning of this past year or even the end of the one before where all of a sudden Lyft and Uber was being reimbursed by Medicare. And so tell me a little bit about, I guess, if that's the regulations that you're talking about or some of the policy changes that have happened. What else is kind of going around in that space that's making transportation part of the healthcare system's responsibility?
Sure, and it's really exciting. Not many people get too as excited about how emerging Medicare Advantage and Medicare can be on this space. But earlier last year, there was a shift in regulation that allowed for Medicare plans to really more address the social determinants of health. What are some of the barriers to why somebody isn't getting the betterment of health that they need, whether that's access to food or if transportation is a barrier. So we have created a model and have come together actually with some managed Medicare plans to empower patients, individuals, to get access to a ride so that they can go to a medical appointment. Otherwise, they would have missed that appointment and turned into an ER visit or an inpatient visit at exponentially higher costs.
I want to back up for a little bit. And so hopefully you know the numbers here. But how many people don't go to an appointment because of a ride sharing, or a ride issue, where they just don't have transportation to the ride? It's actually more common. If I recall, I remember seeing this and I was like, wow, I was surprised at the number of people who don't have a ride to an appointment.
Yeah, as were we. So again, coming from this space, I've worked in medical transportation. I've worked as an EMT. I didn't know how bad it was even when I was in it. But when we started pulling it apart, 1 in 5 patients in the United States misses or delays medical care largely because of transportation as the problem. And if you break that down, that could mean I didn't know if I could get a ride or who would provide the ride. I didn't have a car, or I was in a wheelchair and a car didn't work for me.
Right.
That simple barrier is causing so much pain and stress on that individual in the system.
It is, and not to bring it out of more of the personal reasons, but as far as healthcare goes in terms of cost structure, it seems like this is one of those things that adds expense. Because it's okay, it'd be cheaper to pay for the ride rather than have somebody miss their appointment, miss their dialysis, if that, you know what I mean, miss it and then end up creating a problem that is much more expensive to treat later.
That's exactly right. So that's what we do. So we've created that model that allows for a health plan to empower their members to get rides to get to their cardiologist appointment, their outpatient primary care doctor's office, so that they can get to that betterment of health.
This is it seems like it's such a simple thing, just getting somebody a ride, but it's really actually much more complicated than that.
It is, yeah.
What are you guys seeing in terms of the future for your business? You're a startup company. Where are you guys at? Are you raising money? Have you closed an? Give me a little bit of a sense of where you guys are at in terms of development.
Yeah, sure. Super exciting time. Yep, we're raising money. One of the reasons that we're here, we just identified our lead investor for our Series A, and right now we're just filling in the rest of the round. It's been a great week, but welcoming those conversations from the right partners.
And so your big differentiator, just to be clear again, it's against versus an Uber or a Lyft, is that you guys are using these different kinds of transportation vehicles and actually helping those people who have those vehicles find the right match in terms of patients. That's right.
That's right. It kind of breaks down into 2 key differentiators. So first, you can order rideshare through us, specifically Lyft. We're integrated. You can order those rides. But the second key differentiator is that we're doing the more advanced rides, those wheelchair and stretcher rides for folks that need more mobility assistance. And the third thing is we accept insurance. So for folks that have an insurance benefit that would pay for the cost of the ride, why wouldn't we get that ride covered and provided by an insurance provider?
All right. Mark, thank you so much for joining us. It's a pleasure to talk to you, learn a little bit about RoundTrip. We'll see what happens.
Thank you so much. What an
Awesome.
honor.
Thank you. I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.